Today we will see about the cerebellar peduncles and interpeduncular fossa. So in this figure we can see that this is the cerebellum and it is connected to the midbrain by a superior cerebellar peduncle and to the pons by a middle cerebellar peduncle and to the medulla oblongata via the inferior cerebellar peduncle. And we will see in detail about the cerebellar peduncle. That is, it is actually the afferent and the efferents are grouped together to and it is known as cerebellar peduncle, and it is of three we have already seen. But the main thing is to learn about the afferent and the efferent of each. So superior cerebellar peduncle we will see the afferent. The code is only the thing is we have to keep in mind about the code, and then we will be able to decode them and write. So the for superior cerebellar peduncle, the afferent will be ATTCH and efferent will be ROR. Then just decode them. That is anterior spinocerebellar, tecto, trigemino, and cerebellocerebellar and hypothalamocerebellar. For the efferent, it will be ROR, that is rubral, olivary, reticular, and entorubral and endothalamic. You can, if you need, you can write. Then middle cerebellar peduncle, it is one of the largest of the three, and the afferent will be, the code will be RPS, R for reticular, P for pontocerebellar, and S for ceratogenic fiber. And middle cerebellar peduncle will not be having any efferent connections. Then inferior cerebellar peduncle, it is also known as rustiform, and the thing is the afferent, the code is POP-CAVER, that is posterior spinocerebellar, olivocerebellar, parolivocerebellar, cuneo, and anterior external arcuate fibers, vestibulocerebellar and reticulocerebellar. Then efferent, it will be VOR. Here it is ROR, here it is VOR, that is vestibulocerebellar, olivary and reticular. Okay. Next thing, the only thing is we have to learn about this code, that is ATTCH, ROR, RPS, no efferent, and here POP-CAVER and POR. Then the next thing is interpeduncular fossa. This is the interpeduncular fossa, and in this diagram we'll see about the boundaries and content. The boundary is anteriorly it is having optic tract and optic chiasma, posteriorly it is having pons, and on both the sides it will be having crus cerebri. Then the content is, first content we can see, first of all this interpeduncular fossa is a rhomboid shape. You can see the shape, it is a rhomboid shape, it is already written here. And the content is that first thing that we can see is a tuber cinerum, that is, it is a raised area of the grey matter. Then we can see a spherical mammillary body. Then we can see infundibula. Infundibula means it is actually a small stalk, a stalk which is connecting, a narrow stalk which is connecting the hypophysis cerebri with the tuber cinerum. Okay, it is written here. And the thing is, it is also having a posterior perforated substance, and then we can see oculomotor nerve also. This is a boundary and the content of interpeduncular fossa.